And I'll pass it on to you, Dr. LaSala, to begin.
Thank you. I'd like to welcome everyone to our webinar today on tick-borne diseases. My name is Dr. Mary Ellen LaSala, and I am the Chair of Undergraduate Studies, Stony Brook University School of Nursing. Next slide, please. So I'd like to just talk a little bit about the Healthy Libraries Program, who is sponsoring this webinar today. Stony Brook Medicine's Health Libraries Program, we also call ourselves HELP, is a partnership with the Public Libraries of Suffolk County, the Suffolk Cooperative Library System Outreach Services Department, and is supported in part by the American Heart Association of Long Island. The program is an interdisciplinary team of public health, nursing, and social work students whose aim is to provide evidence-based health information, screening, and case management to a diverse community of patrons in the public library setting. Another aim is to refer patrons to promote access to appropriate health and social services programs locally that will address their health and social support needs. And another aim is for students to experience an interprofessional team and demonstrate the core competencies based on the Interprofessional Education Collaborative. Next slide. And I would like to introduce you to our content expert, Dr. Anna Marie Wellens. Dr. Wellens is a clinical assistant professor at Stony Brook University's Advanced Graduate Nursing Education Program. She completed her Doctor of Nursing Practice degree in 2015 at Stony Brook University. Prior to joining the Stony Brook faculty, she worked as a nurse practitioner in Sag Harbor, New York. She frequently saw tick-borne disease during her clinical practice due to the high prevalence of ticks on the East End of Long Island. She is a member of the East End Tick Advisory Council, which focuses on tick-borne disease education, treatment, and prevention for the community, and as a resource to local healthcare professionals. She is currently co-investigator of an NIH-founded study on Lyme's disease in collaboration with Rutgers University. Dr. Wellens?
Well, thank you very much. You want me to talk about the regional tick?
Yeah.
Well, I do want to say that I'm still working in primary care in Sag Harbor, New York. And I'm still seeing, even with COVID, I'm still seeing tick-borne diseases. So, so they're kind of together this summer. Mm-hmm. But I am a part of the Regional Tick-Borne Disease Resource Center, which is at Stony Brook Southampton Hospital. And our mission is to educate the public, promote collaboration, particularly community and physician educational opportunities within the medical community, and access to diagnosis and treatment of tick-borne diseases. I've been on the advisory panel now since about 2015. And one of the great things about this resource center is we have a tick helpline. So anybody that has a question about anything to do with ticks or symptoms or tick-borne diseases, they can call 631-726-TICK. There is a nurse that mans that call center, and we have calls from all over the world: Hawaii, Australia, Europe, everywhere. So it's very interesting. And we do have a link if anybody's interested, Stony Brook's Southampton, Stony Brook Medicine, for additional information related to tick-borne diseases.
So today our program objectives include identify the definition of a vector, identify environmental and habitat disruptions that increase tick populations, identify common signs and symptoms of Lyme disease, and identify common treatments for tick-borne diseases. Lastly, identify things you can do to reduce your risk of getting a tick bite. Thank you for attending this webinar. We're so glad that you're joining us. We would like to know how well we are doing in meeting our learning objectives. Please complete the poll on the screen. It's anonymous. Name or identifiers will not be recorded or known to us with your responses. And Gabrielle, will you give further direction?
So I'm trying to launch the poll now.
Okay.
Let's see. Okay. So the poll should be on your screen, and the answers are completely anonymous. If you could just answer the questions to the best of your ability. Can everyone see the poll?
Mm-hmm.
Yes.
All right. Oops. All right, so the poll is ended, and we're going to share the results at the end of the webinar and discuss the questions.
Great. Thank you.
Okay, so I'm going to begin with just general information about ticks. And the ticks that I'm going to be presenting today are common in our area, and actually in the Northeast. They're actually all around the country and worldwide. But these are hard-bodied ticks. It makes them a little bit different than from other insects. But the life cycle is the same for all the different types of hard-bodied ticks. And we're going to talk about deer ticks, the Lone Star tick, and the dog tick. So what happens is ticks live for about 2 years as long as they get 3 blood meals. They hatch. They hatch in the spring. They can hatch all year round, but mostly in the spring. The eggs are generally not considered to be infective. They molt into what's called larvae, and I call those the baby ticks. They're about the size of a piece of celery salt, so really, really tiny. And they like to feed on rodents, and particularly the white-footed mouse. The mouse is what harbors the spirochete that causes disease and other pathogens that cause tick-borne diseases. So once they feed, they sort of lay low for a while. They get in, if they're infected, they molt into what's called a nymph, and I call them the teenage ticks. And they need to feed again, because remember, they need a blood meal to progress to the next stage, a total of 3 blood meals. And they will again feed on rodents such as mice or the white-footed mouse, that's common in our area. Or they may feed on another mammal such as man or a dog or a cat or a horse. And when they, while they're feeding, if they're infected, they will transmit the disease. Finally, they will then lay low at the end of their 2-year cycle, and they will molt into an adult male and female. And the females are what lay the eggs. And for their last blood meal, they prefer deer. They're very large mammals, and that is their preferred feeding. That's the mammal that they prefer to feed on. And once they get that big, hefty blood meal is when the females will fall off the deer and then lay the eggs, and the cycle begins again. The next slide. And again, this is the black-legged ticks. These are Ixodes scapularis. They're called black-legged or deer ticks. And again, I spoke about the different stages. Again, for the 2-year life cycle, you have the larvae that are first hatched from the eggs who molt into the nymphs, and then the adult male and female. So again, about a 2-year cycle. Like I said, the larvae are really tiny, very hard to see, the size of a piece of celery salt. The nymph is about the size of a poppy seed, and the adult male and female are about the size of a sesame seed. So again, very small, hard to see. Next slide. The Lone Star ticks, now they're relatively new to the north. They migrated from the south. And again, they are the hard-bodied ticks, same as life cycle as the Ixodes scapularis or the deer tick that I talked about. They have the larva, the nymph, the adult male, and female. The females are noted to with their white dot on their body. And again, the thing that makes them different is they're very aggressive. The larvae are aggressive, the nymphs, and the adult female. The adult males kind of like, they're not as aggressive, particularly as aggressive as the adult female. And then the next slide is the dog tick, and they've been around forever. They tend not to bite humans, although they will if there's no other blood meal available. They feed on what's called the prairie voles. They prefer those little animals, and again, they have the same life cycle. And the next slide shows all three: the black-legged, the Lone Star, and the dog tick. The dog tick's a little larger, the adults are, so they're more easily seen. And again, you will find them on your dogs, but you will find if you have a pet dog or any sort of livestock, you will find all three of these, on animals if they're in an exposed area. And again, this is just another depiction of the life cycle. This is the Ixodes scapularis, but remember, all the hard-body ticks follow the same life cycle. So spring, the eggs will hatch, and they will feed on a mouse, and then they will kind of hang out for a while over the winter, and then they will molt into the nymph, which is again in the spring, and they need to feed again. So if they get the mouse, or they may get us or some other animal, then they molt again. If they're infected, they will then, the next time they feed, they will inoculate their whatever animal or whatever host they're feeding on. And then at the end of their final feed, the adults will die, and the eggs are hatched. Next slide. This is engorgement of an adult deer tick or a black-legged tick, and you can see with feeding how large it gets. And if a human gets bit or by one of these, it's usually well seen. But the smaller the nymphs are, when they engorge, they don't look much bigger than they did before they were feeding. This is an adult female tick. This is a deer tick or a black-legged tick. The females will hatch from several hundred to several thousand eggs. Remember, each one of these eggs, and if you're not itchy now, you will be soon. They will, and again, you can see on the lower part, you can see the translucent larva, then the nymph, and then the adult. And again, the deer tick and the dog tick go through the same process. Next slide. And you can see Lyme disease is the most predominant disease transmitted by ticks. So for every 10 cases of Lyme disease, you have one of the other diseases, such as babesiosis or anaplasmosis, which I'll talk about later. But you can see from 2001 to 2015, this is a CDC depiction. You could see the blue is where the Lyme disease, where the, caused by the black-legged tick. And you can see that the penetrance of this tick is just growing, and every year it gets worse. Next slide. The black-legged tick on the left, you can see this where regionally they are. The Ixodes scapularis are from Texas all the way south, all the way up to the Northeast and the Midwest. Now, don't think that the Western United States is out of, is safe. They have the Ixodes pacificus that causes Lyme disease, so they're still affected. And then on the right, the Lone Star tick, which is the Ambliota americanum, the Latin name for them, they were originally in the South, and they started migrating up probably within the last 10 years. And you see they're not quite to the north of Maine, but they are really migrating up. And this has been a huge problem for anybody that encounters these tick bites. And the tick bites are not always noticed because they could be painless, and the ticks are very tiny. Like I have the poppy seed bagel just to show you those are the size of the nymphs. And they also tend to bite behind the knees and in the armpit or in the groin. So a lot of times if they may be missed, and they could feed and then fall off and without the individual knowing that they've been bitten. And then environmental factors are very important, and habitat is very important because specifically in the Northeast where we live, it's believed that the Lone Star ticks have migrated up from the south with bird migrations, but it's a very complicated process when we look at environment and habitats, because we do have, even though it's very controversial, there are climate changes that are occurring, and this is also played into this. And then of course the factors in terms of the abundance of this white-footed mouse, which is a rodent, and also chipmunks, who are very, very cute, but they also harbor pathogens. They also can have pathogens and other diseases that that the ticks will feed on, and then they can potentially get transmitted to humans or our mammals. And the next slide. And then so we have an overabundance of rodents, and then we have predators are reduced. So if you can recall, because particularly if we look at Long Island, just basically the building and the building of homes and the urban, kind of like the semi-urban sprawl that has occurred. Things like fox and, mountain lions, which are not endemic to, obviously, Long Island, but upstate New York, and again, birds of prey, basically have been either captured or hunted out, so they're not around. Now, a predator is not going to eat every single mouse, because remember, the rodents carry the disease, but the presence of a predator in an area keeps the mice and the rodents at bay. It kind of keeps them in their nests. They don't tend to wander as much, even though, let's say, we do have fox on Long Island. They are coming back, which is a good thing. But a fox in a several mile area the mice know that fox is there. So they don't tend to wander as much. They kind of stay put. So that's a huge issue as well, not having the predators. And the next slide. And now we have the deer. And you can see this is a juvenile deer, female. And you can see on the ears, you see all those like swollen grape-like structures. Those are feeding adult ticks, females mostly. And there can be thousands of them on the deer. We have more deer, although if the deer wasn't here, they would find another animal or mammal to feed on, but the deer are plentiful. And one of the reasons the deer are plentiful is we used to hunt 100 years ago, we hunted deer. And also we were more agricultural as well. And that shifted to the Midwest in terms of farming. And then the hardwood forests populated the Northeast. And then we had all this building where we tore down the forests. And then their habitat is now disrupted. And also the farms now have like 9-foot fences, which were previously not, they weren't allowed to have that height and to keep the deer out because obviously they were eating the crops, which is a problem. So they're constantly getting pushed out of their small wooded, like we call them chaparrals. And now they're in where are they? They're in our front lawns in our backyard, and they're right next to us. And we see them walking down Main Street everywhere. And a problem, there's so many of them, they're being displaced. They are obviously causing issues with traffic, accidents and things like that. So, and they're a nuisance for anybody that wants to have any sort of garden as well. The deer are very good at reproducing and eating. Those are the two good things the deer are good for, very good for. They're cute, but there are way, way too many of them. Next slide. And just one thing, this is the disruption of the habitat. So you see you have all these like little hardwood chaparrals that are being torn down to put in a home that maybe somebody will spend a couple of weekends in the summer, or just like huge swaths of properties just being torn down in terms of the habitats. And that disrupts the deer and other animals as well, just not the deer. And when I think of the deer as they're the transporter of ticks. I think of them as a giant like cruise ship carrying ticks. So whenever you see a deer in your driveway or on your lawn, they're sleeping at night, the ticks are falling off and the females are laying eggs. And then you have those thousands of eggs that are being hatched on your front lawn, backyard, and all around us. Next slide. So just to get back to a little bit of science, a vector is an organism, typically a biting insect or what here is tick, that will transmit a disease from one parasite or a parasite from one animal to another. So they become infected when they feed on an infected mouse or another rodent. And then they will transmit that disease when they're feeding on the next animal. And if it's us, we're human, and we can become infected. And again, dogs and horses are also infected. And the reservoir is an animal such as a rodent where the infectious agent normally lives and multiplies. They don't seem to be affected by it. They have an immune system. And this is something that really needs to be studied more, how they keep the infection at bay without getting sick. But the reservoir typically harbors the infection without any injury to itself. Next slide. And we're the host, and also the deer are the host as well. Now we don't know how, obviously we can't interview the deer to find out if they have a headache or a fever, but they seem to do okay. They are a reservoir, though. We talked about a host as an animal or that in which a parasite, bacteria, virus lives. They are the reservoir for a disease called auriculosis, which I will talk about later. But we are, as humans, are inadvertent hosts. Particularly the adult ticks prefer not to feed on us. They prefer the deer. It's their preferential host because they can get a nice big fat blood meal. And the better their blood meal, the more eggs the female will lay. Next slide. And here we have an adult tick on the right, and you can see them perched on a blade of grass. This is what's called questing. You can see their back legs, they're an arthropod, and they're holding on to the blade of grass with their back legs, and their front kind of arms are stretched out. They are what's called questing, and what happens is they can sense carbon dioxide, heat, and vibration. So if we're walking by and they need a blood meal, they'll attach to us or a horse or a deer. and that's called questing. So they will climb up on the blade of grass, wait for somebody to come by or something, and they need humidity to survive. They do not live in the hot sand at the beach. You will not get bit by a tick. You'll get bit by something else at the beach, but not by a tick. But they are in the dunes or any place that's shaded and where there's moisture. They need the moisture to survive. On the left, you can see the bicycle, and I use this picture just to depict, this is where the ticks are. If the deer have gone through this area, they lay the eggs down, and then the ticks are now in that area, and they will molt from the larva to the nymph to the adult. And the poor person who's going to retrieve that bicycle is needs to be in a hazmat suit in order not to get to be covered by ticks. Next slide. So the most common, like I said earlier, the most common tick-borne disease is Lyme disease. So for every 10 cases of Lyme disease, you have one of the other that is listed down, that's transmitted from the Lone Star tick and the dog tick. So the black-legged deer tick or the Ixodes scapularis transmits a Lyme disease, which is the organism is a spirochete. And it is related to syphilis. It is a cousin to syphilis. So a lot of the signs and symptoms of it, there's an overlap with what was, signs and symptoms of syphilis. There's a relationship there in terms of the symptoms. They also transmit babesiosis, which is a very serious disease, and anaplasmosis. The Lone Star ticks transmit auriculosis. Now again, the reservoir for this is the deer. They transmit something called STARI, which is Southern Tick-Associated Rash Illness. They believe it's a Borrelia. The Lyme disease organism, the spirochete, is Borrelia burgdorferi, but the STARI is a Borrelia. They believe it's a Borrelia. They came out with it being Borrelia and they retracted it. So they're really not exactly sure what causes it, but it is treated with the same medicine as treated with Lyme disease. The other thing that the Lone Star ticks can do is called the alpha-gal meat allergy, and it's becoming more common. People are talking about it more, and those are from Lone Star tick bites, usually repeated Lone Star tick bites. They also transmit a rickettsial disease, which is very similar to Rocky Mountain spotted fever. It's not as a severe infection that's caused by the rickettsia, which causes Rocky Mountain spotted fever, but it can make individuals very ill. And tularemia is another thing that it's not common, but it can be transmitted by the Lone Star tick. The dog tick will transmit the Rocky Mountain spotted fever and also tularemia. Now, the Rocky Mountain spotted fever that the dog tick transmits will cause someone to be very, very ill. They will require to be hospitalized. There's not that many cases. There's about maybe 2,000 a year in the United States. Again, they don't have a preference for, basically feeding on humans. However, children can get affected, and they most often wind up in the hospital. They're very, very ill, and they need to be treated very quickly, in what otherwise they have very serious consequences. The next slide. So when you look at if we look at just in our own local area in the Northwest, we're on Long Island, where we have oceanic exposure to the water, and and again our own environment, which we're obviously a cause of that disruption. So we're in what's considered an endemic area. So we're exposed by ticks, even if we're inside our house. If we have to walk out to our driveway and there's any sort of grass or any sort of vegetation, we're exposed to potentially ticks. So, and again, rash is a very good thing to note in terms of history, because that's particularly for Lyme disease, although it can happen with STARI, which is transmitted by the Lone Star tick. So rash is very important. However, rash a lot of times is not reported, or it's missed, or the person who develops particularly Lyme disease, may not report a rash or have a rash at all. So you look at symptoms, and flu-like symptoms in the summer, although this summer is a little different because that could be COVID, COVID-19. So, but flu-like symptoms generally in the summer, headache, muscle aches, fever, chills, fatigue, their flu-like symptoms without the nasal or the cough are not usual in the summer. They're usual in the winter. The other thing is a facial palsy or a droop on one side of the face. That is also, again, those are part of the cranial nerve system, and Lyme disease particularly can cause that. And that's significant, and that's a clue that that if somebody has like that facial palsy, that they could have Lyme disease. Labs and diagnostics are very tricky. We do have a tick panel that we can order on patients. We can test all the diseases except Lyme disease does not show up in the blood early on. So that's a challenge, which I'll talk about later. But we can test directly for babesiosis, anaplasmosis, auriculosis, rickettsial, all of those, because they stay in the blood. They're an infection that starts out and stays in the blood, not unlike Lyme that does not stay in the blood. We can also do a parasite smear for babesiosis, and we can actually see the red blood cells we can see that the parasite is in them. So that can be very helpful. And then of course, early treatment is very important, identifying the signs and symptoms and getting treatment early. And then again, very important to reduce further future exposure, to really to mitigate things that can be done that may be inconvenient, but are very important, particularly if you live in an endemic area like Long Island. So Lyme disease, there's estimated 300 cases a year. This is a low count because these are confirmed by blood tests. And again, basically, Lyme disease is usually diagnosed by, by symptoms and the presence of a rash, because there is really no early blood test. It can't be cultured out. If it can be, it's a very short window where the spirochete stays in the blood. And it's estimated that 40 to 60% of adult ticks, the black-legged tick, is infected, and about 20% of the nymphs are infected. So when those nymphs or the larvae are feeding on the mouse, not every single mouse is infected, not every single chipmunk or other rodents or birds can also carry these diseases. They're not all infected, but if they are, this is testing that's done by the Department of Health. They drag for ticks, periodically, and they test the infection rates. So the nymphs are active right now, spring and summer, but the adults continue to be active all year. Particularly if temperatures are above freezing, they will start coming out of, they don't die in a really hard freeze, and they need humid conditions. So otherwise they will dry up and die. The next slide. So the chances of getting Lyme disease, which is again the most common tick-borne disease, is if they're feeding for greater than 24 hours. And the tick mouth part is anchored it cements itself into the skin, so it really gets in there. The tick saliva can be an irritant, or some people just don't feel it, but they also secrete like an anesthetic agent as well. So what happens is when they're feeding, it's like a backwash system. The spirochete or for Lyme disease, or Borrelia burgdorferi, is in the gut, and it washes back into the mouth as it's feeding. So it's like this regurgitation of their stomach parts going into their mouth and then inoculating an animal or a person. We're only seeing, the CDC says the bullseye rash is present like 70 to 80%. We're only seeing less than half of patients that have Lyme disease with the rash. Sometimes they don't realize they have a rash, or it's an atypical rash that they discount, but we're not seeing bullseye rashes consistently. And it may be because people are getting infected over again. So the subsequent infections, maybe they're not mounting a rash. But flu-like symptoms, joint muscle aches, fever, chills, headache, neck pain, fatigue, mental cloudiness, what they call typically a brain fog, and this facial palsy where they have a droop on one side of their face, or any sort of visual changes should point to a tick-borne disease. Next slide. So again, there is a diagnostic test, but it's a 2-tier antibody test, or they call the ELISA Western blot. And that is only if that will come positive if someone missed where they didn't know they had Lyme, or they disregarded the symptoms, because the symptoms are elusive. You're not feeling well, you're sleepy, you're fatigued. It could be for 100 different reasons. Because you don't always have the full-blown symptoms that are listed under Lyme disease. So if it was missed in a month, you will see positive antibodies. If it's treated early, which is what we want, you will not see any antibodies mount. So if the person got antibiotics early, a month later, they're not going to have any antibodies, which is what we want. So based on symptoms, or what we call empiric treatment, we will prescribe doxycycline for 14 to 28 days, based on history, based on rash, based on a known tick bite, although we don't go for that date, because did you get bit by a tick? Well, I don't know. Well, if you're here living on Long Island, you are in an endemic area, so your chances are very high that you could have gotten bit by a tick. So the doxy is good. It's not given for children under 8 years old. It is, however, very important for children. For Rocky Mountain spotted fever, only doxy will work, but it's a short course, so it's safe for children. But for long courses, it's not recommended because they're tooth staining. The other thing that's really important with doxycycline, or any of the antibiotics, because amoxicillin can be given, and there's also cefuroxamine is another. It's a cephalosporin antibiotic, can be given if someone's allergic to doxycycline, as well. But it's very, very important that individuals that are put on antibiotics finish the antibiotics. What I see in practice, and other providers do as well, is that somebody comes in, they have some symptoms, they may have mount a rash, they're put on doxycycline for 14 days. We'll do a telephone call. I only had the rash, I'm feeling better. I only took it for 3 or 4 days. I'm feeling better, I don't need it. No, those are the individuals that will wind up having possibly long-term sequelae or complications of Lyme disease if they do not finish the course. So it's so important. And what, we can extrapolate information from other conditions that we give antibiotics for, and we know from that patients, about 50% of patients do not finish their course or do not take their medicines as they're prescribed. So it's very, very important. This is a real drive home message that individuals have to take their medicine complete. And if they have problems, that they need to call their provider. This is the 2-tier test I was talking about. So the initial test for Lyme disease, if it's positive or equivocal, then it goes to the Western blot. And the Western blot looks at bands. I look at IgM and IgG. Which are antibodies, they're proteins, we look for the signature proteins for Lyme disease. But again, if someone's treated early, this would be negative. The next slide. This is a typical EM rash, or a bullseye rash. You can see EM is erythema migrans, but you can see here, this is very, very classic. But remember, not all rashes appear this way. But you can see the red, and then the clearing, and then another expanding rash around the area of clearing. The next, and then again, this is a very light rash. You can hardly see it. You have to really look at the light. You need really good lighting for this. And then the next slide. Again, this photograph is from a student that I had whose daughter got bit by a tick and was misdiagnosed as an infected mosquito bite, and she had Lyme disease. Next slide. And then, so Lyme, you have early infection, you could get you could have signs and symptoms 3 to 30 days after exposure. So real long incubation period. Rash, flu-like symptoms. If it's not treated right away or recognized, it can go on to cause joint pain, arthritis, headache, fatigue, and they can be neurological and cardiac involvement. And then stage 3 is persistent months to years. They have really chronic symptoms. The Lyme organism, or the spirochete, stays in the blood for a very short period of time. It likes to go into collagen-rich tissue, which is the neurological system, the spinal column, and the heart. They love, the spirochete loves, and the joints as well, and skin. That's where you get the rash. Next slide. And this is a Lyme a Lyme knee, and you can see the swelling. So this person missed the early onset of Lyme disease, and now they have a swollen knee, and they will require treatment. Next slide. And then there's something called there's a certain subgroup of patients that they get treated. They get treated for Lyme early in the course. Hopefully they completed all their antibiotics, although that hasn't been studied. But there's a theory that somehow or another, everyone's immune system is a little bit different. We have genetic variability. Some have more robust immunity, some have less immunity for a lot of different reasons. But they believe that the dead organism, the dead spirochetes that are being cleared up by our own white blood cells may somehow or another trigger an autoimmune response. And then you get these arthritic symptoms and other chronic neurological symptoms. And neuro-Lyme, or if it infects the neurologic system, those patients require spinal tap to analyze the spinal fluid. And if positive, they need IV antibiotics for a month. And also cardiac involvement, because it does like to go to the heart. Again, very rich collagen in the heart muscle, and that can cause complications, causing heart block and arrhythmias. So those patients can be very ill from this. The next slide. So these patients, there may be, it's like 6 months after being treated, they have these medically unexplained symptoms, they have cognitive difficulty. So they usually wind up going from one provider to another. And unfortunately, there's a lot of people that put out a shingle and they put you on a lighted table, or they give you shark oil, or other treatments that are not evidence-based, not scientific, because these patients are desperate for help. The next slide. Now, babesiosis is also increasing, and you can see the red blood cells on the left. Those are called Maltese crosses in the red blood cells, signature for babesiosis, which is a parasite similar to malaria. Usually if somebody has babesiosis, now interestingly, children generally do not get babesiosis unless they're immunocompromised. They somehow or another clear really, really well, and their livers work much better than adults. And if an adult is drinking alcohol, quite a bit of it, they will have more problems with babesiosis. So alcohol intake does affect the ability of the body to fight babesiosis. But severe symptoms, these are more than a Lyme presentation. Severe headache, severe fever, and then you can tell right away if there's babesiosis. And a lot of times just regular blood counts, have abnormalities. And it's treated with something different. One of the things that's really important is all the tick-borne diseases pretty much are treated with doxycycline. This is not, and this is why it's so important, because you can have two infections at once. You can have Lyme and babesiosis, or you could have what you think is Lyme, but it is babesiosis, so it's really important to rule out babesiosis. But the treatment is a combination of azithromycin and atovaquone, which is the other word is Mepron. And unfortunately, Mepron or atovaquone is very expensive, which is a problem for our field workers, landscapers, if they don't have insurance. Next slide. I put auriculosis and anaplasmosis together because their symptoms are similar. They're from two different tick. One is the auriculosis is the Lone Star tick, and anaplasmosis is the deer tick. They stay in the blood, so again you can culture it, which is really good. Anaplasmosis infects the monocytes, and auriculosis affects the granulocytes, so they're in the blood. And again, overlapping symptoms, very hard to figure out what do we have here, but fever, chills, fatigue, headache, severe muscle aches. Usually these patients are sicker, and again, you can have Lyme and anaplasmosis together, or auriculosis and Lyme together. So those patients tend to be really sick if they have a co-infection. And again, a lot of times you'll see, abnormalities in the blood counts, which can be telling as well. It's treated with doxycycline. And again, if somebody has severe symptoms and they have a rash, you will suspect that they have two different infections. But again, we just want to make sure that the other infection is not babesiosis, because they may need doxy and the treatment for babesiosis, which is more medicine, different medicine. Next slide. Rocky Mountain spotted fever, I know I talked about that. And again, very, very, if it has to be treated right away, and it's from the dog tick, but again, it's noted for its rash on the hands, palms, and feet. And again, it's early treatment with doxycycline. And these patients usually are in the ICU because they're so ill. Next. I just want to mention other tick-borne diseases. We have Borrelia miyamotoi, which is very similar to Lyme disease. It's treated with antibiotics, which is very good. Where the Department of Health also monitors for this in ticks. And the Starry Southern Tick-Associated Rash Illness is similar to Lyme, treated with doxy. Powassan encephalitis is a virus. Again, this is rare. There's been no cases in New York State. But there have been cases in, I believe, Maine and New Jersey and the Midwest. And again, this is a very high death rate, 10 to 15% of infected individuals. So this is not something, these are patients that wind up being in the ICU for supportive care. Next slide. And then I want to talk about the alpha-gal meat allergy, because this is increasing in its incidence. This is caused by the saliva of the Lone Star ticks. It could be the baby ticks, which I talked about as the larva. And basically what they do is they inoculate animals, or us with a carbohydrate, and it's called alpha-gal. It's something that we don't have in part of our blood or immune system. We just don't carry alpha-gal, this carbohydrate. It's present in non-primate mammals. So humans and chimpanzees and old world monkeys don't have alpha-gal. So if we get inoculated with these Lone Star tick, either the larval bites, which that happen in the late summer. Remember, these Lone Star ticks are very aggressive. They are ferocious feeders. So normally individuals will say, I got chigger bites at the end of the summer. No, there's no chiggers on Long Island, but what they did get was these Lone Star tick larval bites. And what it does is this carbohydrate will cause antibodies, so that if you then eat meat, mammalian meat, you will get a reaction. You get an allergic reaction. It's delayed reaction. We call it midnight anaphylaxis. So you have a cheeseburger at 6 o'clock. At night and 11 o'clock, you wake up with hives and you need to go into the emergency room. So it's really, and again, it's any hoofed animal, pork and cows, anything with the hoof, not chicken and not fish. And next slide. So again, you can have an array of allergic reactions. You need medical attention. You can get tested for alpha-gal. You need to be referred to an allergist. You need to avoid mammalian meat and gelatin or anything that's made with meat. And it does tend to go away if you're not re-exposed to the Lone Star. I have the larva here, but Lone Star tick bites in general. And these patients need an EpiPen because they could have swelling of the tongue and the mouth, which is a medical emergency. So they do need an EpiPen to have with them at all times, and also be in the care of an allergist. And these are larval bites, and keep in mind that these larvae are still inside the person. They feed for a couple of days, just like other ticks do. So these are hundreds of them. So these are not chigger bites if you're on Long Island. These are Lone Star larval bites. So you want to stay out of you don't want to go barefoot in the grass at the end of the summer, or any time, but particularly at that time of the year, at the end of the summer. The next slide. So very important with ticks is if you see them, remove them immediately. We recommend fine-tipped tweezers. Try to grasp it by the head. You don't want to try to avoid it from the midsection, because you could push the pathogens back into this through the skin. You want to pull them straight up and out. That's the best way. There's a lot of old wives' tales: no burning, no gasoline, no lighter and gasoline. That would not be good. And no other weird kind of treatments, because that, like even acetone and whatever, because that can cause an infection, a secondary infection. Next slide. So there is there was a study that was done. It's not a new study from the New England Journal of Medicine, and it did look at a 2-tablet doxycycline treatment for anybody that had a tick bite for more than 36 hours, or if the tick was noted to be engorged, that they would get a doxycycline prophylactic dose. And still, when we do this for patients, we always tell them to look for signs and symptoms of any sort of tick-borne disease. Also, doxycycline needs to be given with food, non-dairy, and usually I recommend a probiotic if they're doing a full course, particularly, and stay out of the sun because they'll get sunburned. So any dosing of doxycycline, you have to watch the sun, but it can upset the stomach, particularly if it's taken on empty stomach. So usually I tell them to take it with bread or a cracker, not with milk. Next slide. So protecting yourself, okay, you want to cover up, you want to have light colored clothing, and you want to be really fashionable by pulling your socks over your pant legs. But this makes ticks easier to see. Now remember, ticks do not fly through the air. Again, you have to brush up against vegetation or grass that when those ticks are questing, looking for a meal. And so you want to walk in the middle of trails. You want to wear a hat, long sleeve shirt, light colored clothing. And this is if you're out in high concentrated tick areas. You can spray repellent on clothes, particularly the shoes are very good. There's something called permethrin that you can get in the hardware store, and you can spray your shoes once a month out in the driveway. You can also spray your clothing out, outside. You don't want to be doing it indoors because it is a pesticide. It does dry. It does not absorb onto the skin, but it will kill ticks that will attach to your clothing or your shoes. No bare feet. So these are things that are very helpful, particularly for people that are outside a lot. And again, children are high risk exposure, and retired individuals because they tend to be out in the garden, so they tend to have the most exposure. Next slide. And this is a 4-poster program. This has been shown to be, remember I talked about the deer are the carriers of the ticks. So this has been successful in the areas that they used it. They have these corn feeders. So when the deer want their corn, they will put their heads through rollers that are coated with permethrin. The permethrin that they get on their head and neck will kill all the adult ticks that are feeding on them. So if you kill the adult ticks, you will then not have the larva. And if you don't have a larva, you will not have, again, you will reduce the tick populations. In the areas, particularly Shelter Island, that they use this, they found it to be very effective. However, it is expensive to maintain, but it is definitely something that has worked. Next slide. This repellent, I talked about the permethrin, put this on your clothing. The skin repellent, you don't want to put the permethrin on there, you just want to use something with DEET. That's the most effective, although the lemon eucalyptus oil can be very effective as well. Next slide. And again, now the repellents give you the time for reapplying, like 4 to 6 hours. So definitely read the instructions for reapplying on your skin. And again, very important, repellent, cover up, permethrin, which is you put in your shoes and your clothing. And a lot of the camping supplies and clothing now come with permethrin embedded into tents and knapsacks. So that's happening more and more. The best thing to do is if you're outside at the end of the day, when you're done with your activities, get into the house, go immediately into the shower. While you're in the shower, put your clothing in the dryer before you wash them. Remember, the ticks can survive a washing machine cycle, but they will not survive 20 minutes of high heat on a dryer. They will die, they desiccate, they just will shrivel up and die. And while you're in the shower, whatever is crawling on you will get washed off, and then you can do your daily tick check. The things that are helpful for people that are outside is double-sided tape. If you have boots, you can put that at the end of your pants and where your boots meet, because the tape traps the ticks. They won't go anywhere. Lint rollers when you come in, because that'll pick up the ticks and they won't then go onto your skin. And again, no flip-flops. And then in terms of pets, oral medication, frontline, remember they can still carry them into the house, keep them off furniture and bed. They can get sick as well, particularly with Lyme disease. So you need to be careful with your pets. And next slide. And again, just be mindful around your house. High, tall grasses close to the house is not so great. You want to keep grass that's mowed 3 inches or less. The ticks don't like the sunshine, so short grass, play areas in the sunshine, remove leaf litter, debris, create borders that sort of like a protective border from the wooded areas. The ticks don't necessarily like to cross over pebbles and cedar chips. And the next slide. And things like pachysandra and ivy, ticks love. Rock walls, wood piles, bird feeders, they're beautiful, but they attract mice and chipmunks. And then you have, these are the reservoirs, remember. They get close to your house, and then, next thing you know, that they're closer to you. So you want to keep them away. Garbage and contained, and then again reduce plants that attract deer, and then you can get spraying your property. You can get someone that knows what they're doing, that are vetted to spray property, and they can do organic or the traditional pesticides, which is becoming more and more common. And this is a perfect world picture of not having tall grass by the house and having borders. So this is just something to create a tick safe zone, just as a helpful visual. And a future vaccine for Lyme disease, there is trials that are underway. There was a Lyme disease vaccine a number of years ago, but it proved to be ineffective. It didn't have longevity. So basically, you're looking at blocking the ability of ticks to feed with a vaccine, but it will only help with Lyme disease, not with the other tick-borne diseases. And the next slide. And again, the CDC is a great resource for information. So I recommend between that and the Lyme Disease Resource Center. And I'm open to questions.
Yeah, so thank you everyone for attending this webinar. We're going to do another post survey, post poll. I'm going to launch it now, and it's again anonymous, and it's just to see how well we are doing in meeting the learning objectives. So I'm going to launch the second poll. So if you could just complete this poll as well. We're just going to give it one more minute so everyone has time to complete the poll. All right, and just to go through the poll answers, was that based on what you know based on what you know a vector is, what is the best answer? That would be tick. Select the reason why there are more ticks on Long Island. This could be because there's too many deer. It is false that Lyme's disease is the only tick-borne disease. And some common symptoms of Lyme's disease is the rash, fever, muscle aches, and fatigue. Runny nose and a cough aren't common symptoms of Lyme's disease. It is also false that if a person gets Lyme's disease, it'll eventually go away on its own. And the common strategy to prevent or reduce exposure to ticks, and the examples given are wearing a hat. You shouldn't wear short sleeves or shorts when you're going into a tick populated area, like going hiking. You should wear long sleeves and long pants. You shouldn't wear dark colors. Lighter colors are better so that you can see the ticks. And you should always wear closed-toed shoes. So it's not recommended to wear sandals. And so, yeah, if you have any questions, we can now refer to Dr. Wellens to answer these questions. Someone asked, what do you mean by aggressive? And I think this is when you were talking about the female ticks.
Lone Star. Yeah, the Lone Star tick nymphs, the larvae of the nymphs and the females, the adult females are very aggressive. They're called hunters, and they will travel longer distances than the deer, the black-legged deer ticks will. They also can, because I guess they're from the south, they can tolerate less humidity. They don't need to rehydrate as often as the black-legged deer ticks are. They're very, very aggressive. They're called hunters. They will travel further to get a meal.
Does anyone else have any more questions? Some questions that we were wondering is if any of the participants thought there was anything missing from the webinar, or was there anything else that you have questions about or would have liked us to discuss? So Dr. Wellens is here to answer any questions you all have.
I have a question. So I live on the east end of Long Island, and I get my property sprayed with, the ingredients to help get rid of the ticks. And I have an organic solution that goes down to help kill the ticks. And you said in your presentation that organic pesticides are okay.
Yeah, they have to be reapplied more frequently, and they can also get diluted with rain. Okay. So, and if you have a really good person who knows what they're doing, they're vetted, they're supposed to be, that they have a vetted firm, a vetted company. They're very, very knowledgeable, and they can discuss, depending on where you are, they'll advise you. But yeah, the organic is good, but you may have to reapply it more often.
And he does come more often.
Okay. All
which
right.
I have questioned, and it smells delicious when he sprays it.
They're probably essential oils.
Yes.
And even with the regular pesticide use, it does not affect, because they spray low to the ground. They're spraying the grass area. It doesn't affect pollinators. It doesn't affect bees or hummingbirds or anything else. So it's not like it's killing everything. It's just hopefully just killing the ticks.
Great. Thank you.
Are there any other questions?
I have a question. If you have a tick bite that you're concerned about, and you do have blood testing done, how many times do you need to have that done to be certain that you don't have a tick-borne disease? Is one time enough, or should you follow up again a few months later if you're having some symptoms? What is kind of the guidance there?
For Lyme is a little bit different than the other tick-borne diseases. The other, outside of Lyme, you can get an early test for that disease, so you know what you're dealing with. Lyme disease, what I recommend is no early testing, because it's not going to yield anything. If you get treated early and you are feeling well, you don't need a test. If you get treated early and you're still having symptoms, definitely will get a test a month out. Or if you were treated late for whatever reason, I'll get a test. So because antibodies don't show up until 3 to 4 weeks after exposure. So it really depends on the specifics of the situation.
Okay, thank you for that.
You're welcome.
Is this year a particularly bad year, or what are you seeing?
Well, we're kind of, it's bad out there. There are a lot of ticks and people are getting bit. One of the problems in primary care is that I'm doing a lot more telemedicine, and people are a little reluctant to, because of social distancing and things like that. So, but I don't, it doesn't seem any different than years prior in terms of the ticks. It's just getting worse over time.
Mm-hmm.
But it's more challenging. And if you think about COVID-19 and Lyme disease or any of the tick-borne diseases, like really, there was a joke going around, Corona with Lyme, the Corona beer with Lyme. So, but yeah, so we've been just treating, I've been seeing patients on telemedicine and just treating them, based on their symptoms.
There's a question in the chat asking if some people are more susceptible to Lyme disease than others.
Well, again, the ability to clear it, particularly, you need the antibiotics because although there have been cases of individuals that showed antibody positive, and there's two types of antibodies. There's IgM, which M is now for miserable, and IgG is for gone. And there have been cases of individuals that have had high type IgG, past infection, that were never treated. Although, however, if you get treated with an antibiotic for another reason, it may also help Lyme. But there also is some question. Some people tend not to get bit by ticks for whatever reason. But again, the Lone Star tick will bite anybody. So that's kind of the Lone Star tick kind of just throws out for a loop there. But we all have different immune systems. So, but I generally, people cannot clear this. Not like babesiosis in a child where they can clear it. Anybody who gets Lyme disease, it's very, very difficult they will not be able to clear it on their own for the most part. I think it's very rare.
There's a new question in the chat about what is the best way to clean the wound after removing a tick?
Alcohol.
Okay.
Yeah, and you can put a little antibiotic cream on there, that's fine. And a lot, like the Lone Star tick bite, that will leave a mark, particularly if you're very fair, for a long time. So I have patients that come in, I have all these brown bites, and I said, that's, from the tick bite. You have to also be careful about putting steroid cream on. You can put a little steroid cream for the itching, but don't slather it on because the steroid cream can discolor skin.
Mm-hmm.
I have a couple questions. Can you hear me?
Yep.
Yeah.
Okay, I'm the one who asked about if some people are more susceptible. Oh, maybe about 25, 30 years ago, my husband got Lyme disease and got the classic bullseye ring, was treated with tetracycline at the time.
Mm-hmm.
And then a couple years later, he got it again. Same classic ring, and again, each time was treated. So I was wondering if he's more susceptible than, maybe another person.
Well, it depends if he's outside and he's working, occupationally, you're more at risk if you work outside. Like that's why the landscapers and farmers and the migrant workers are real challenged because they usually don't have healthcare access. But yeah, if you're outside gardening or outside working, you're more at risk. And if you get a rash and symptoms, you keep getting exposed, you will keep getting sick and you'll keep needing antibiotics.
Okay, so there is no antibodies that will build up that will prevent you from getting it again?
No, that's why we're looking for a vaccine. Yeah, no.
Okay, and I guess doxycycline is now the preferred treatment.
Doxycycline is preferred. You can also use amoxicillin, and there's some other, like I had a patient who was allergic to everything and she had to go on azithromycin. That's the last layer.
Is doxycycline more effective than tetracycline?
Yeah. Well,
okay.
Tetracycline is like, doxy is a derivative. It's from, actually, I think doxycycline may have been discovered at Stony Brook, believe it or not, back in the day. But it's a newer generation from the tetracycline. Same family, but it's a newer generation drug. Very effective.
Thank you.
All right, we're a little bit over time, so if anyone has a few more questions now, please ask them. Otherwise, this will be the end of the webinar. And we would just like to thank Dr. Wellens again. Thank you so much for presenting all this information.
Okay, and if also you can reach the Tick Center, it's 631-726-TICK, and you could talk to the nurse who's very savvy on tick-borne diseases.
Thank you, Dr. Wellens. Thank you, Gabriella, and everyone who participated today.
Thanks for having me.
Cool.
All right, thank you.
Okay, bye.